Welcome back, everyone. Dr. Ford here. Today, I'm going to be talking to you about a very intriguing topic that I get a lot of questions asked about, and that is the truth about peptide supplements and what they're not telling you. As a doctor of pharmacy and practicing healthcare professional, this is a very important topic to keep you and your family safe when consuming over-the-counter peptide products. Right now in the USA, there are more peptide supplements on the market than ever before. And unfortunately, many of them are fake, contaminated, or dangerously underdosed. You see, peptide supplements are poorly regulated entities. Most of them are never inspected by the FDA, and their products are rarely verified before they're hitting the market. So because of this, the market becomes flooded with products and supplements that are misbranded, poorly manufactured, and outright fraudulent. So today I'm going to be breaking down some of the biggest risks, giving you simple steps you can follow to protect yourself from taking a completely ineffective peptide. The industry of peptide supplements is still the wild, wild west. And let's begin with some of the biggest misconceptions. Mainly all the peptide supplement manufacturers are not regulated by the FDA at all. They don't require FDA pre-FDA approval. They don't require FDA approval. And companies can launch a peptide product without even proving that or providing that, showing that it's safe, real, or accurately dosed. Most of the manufacturers have labels that say for research use only or for not for human use, as a disclaimer to protect themselves. There are no required FDA inspections of their manufacturing facilities. Many peptide supplements are actually manufactured overseas and never audited. So there's little to no quality oversight. Some operate without any quality standards, safety standards, or almost any documentation at all. There's no requirement for independent third-party analytical testing. So a company could sell a peptide supplement without even sending it to the certified analytical laboratory, and products could enter the market unchecked, unverified, and often completely misrepresented in terms of quality or potency. This is how a lot of fraudulent supplement peptides flood the market. You know, they look really cool, they have really slick labels, scientific claims, attractive branding, but behind the scenes, no one's verifying anything. Make sure when you buy your products, your supplements, make sure the company provides you with a certificate of analysis, also known as a C of A. Because remember, the FDA does not evaluate supplements before they're sold. So this C of A is the only way, it's the only report that tells you whether the peptide is real, is high quality, or even suitable for human use. But here's the catch. Many fake C of A's are extremely common. So you need to know exactly what to look for when you're looking at a C of A. If it looks like it was made from a Microsoft Word document, it probably was, and it's more than likely fake. What to look for? A couple things. The lot number on your bottle and expiration date on the bottle must match that of what's on the C of A. Some bottles don't even have an expiration date on the bottle. If the lot number doesn't match, if the expiration date doesn't match, what's on the bottle, what's on the C of A, don't buy the product. Purity percentage. Now, purity tells you how clean the peptide is, meaning how much powder consists of the actual correct peptide molecule versus unwanted or incomplete chains that are manufactured byproducts. So the C of A shows you, if the C of A shows you 90% purity, this means that 90% is the correct peptide and 10% are impurities. So low impurities means higher toxicity rate, lower effectiveness, and contaminants. So many low tier supplements don't even come with a purity close to 95%. The next thing you should be looking for is something called peptide content percentage. Now this is very misunderstood number. Purity and peptide content are completely not the same. You see, if a vial is labeled as 10 milligram peptide and it says the C of A says peptide content is 80%, this actually means that you're receiving 8 milligrams of the peptide out of the 10 milligram on the label, even if the purity is very high. The peptide content is actually what dictates the dose accuracy and potency. The purity does not have anything to do with potency. So peptide content is actually the percentage of the actual peptide you're actually receiving. Next, many manufacturers don't even come with these peptide content testing, so that's what you should be looking for. They only report purity, which looks very impressive on paper, but gives the consumer a very false sense of quality because they see a high purity, assuming that it's a high peptide content product, which is not. Make sure when you see on the CVA, you're looking for microbial testing, whether testing for yeast, E. coli, salmonella, and it not just say pass, it actually shows the count. And if it doesn't have any microbial testing at all, that's a major red flag. Make sure the testing for heavy metals like lead, arsenic, mercury, this should be extremely low or not even detected at all on the C of A. They should have analytical test methods on the C of A like HPLC, mass spectrometry. And if the C of A just says conforms, this usually means nothing was tested. The third party lab name should have a signature, should have a date, should have the actual QC analyst name on it. And so therefore, if you don't see a signature, date, name, this is not legitimate C of A. So let's recap. What do fake C of As look like? Common red flags. There's no lot number. The lot number doesn't match the bottle, what's on the paper. There's no test methods. It only says pass, no real data. There's no lab name or accreditation. They're the same C of As reused for multiple products. You see spelling errors or sloppy formatting. You know, if it looks like it was made on Microsoft Word, it probably was. So let's not be confused. Peptides have an incredible potential and the benefits are real. But on the supplement side of the industry, it's still the Wild Wild West. The FDA does not regulate peptide supplements the way people assume, and the only real protection is education. Knowing how to read a certificate of analysis could protect you from wasting money or just taking something unsafe. Share this episode with someone who uses peptide supplements to stay safe. Until next time, stay safe, stay educated. Dr. Ford.